If you're not in the field of mental health, it can be really easy to confuse psychiatrists, psychologists, and therapists. And we all offer different services. They are similar, they are related to each other, but they are different. So let's talk about it. Disclaimer, I am based in the United States, and places outside of the United States might navigate mental health services differently, so keep that in mind. Generally speaking, here are the differences within the United States. A psychiatrist is a medical doctor that specializes in mental health treatment, and they can prescribe medication. Psychiatrists can diagnose. Now, here's where it gets a little tricky. Psychiatrists can technically provide therapy, or at least they can bill therapy services to insurance companies. However, that doesn't mean that it is actually therapy that is taking place. Some psychiatrists do have extra training, and some do actually provide like talk therapy or somatic therapy alongside prescribing medications. I want to say, at least in my experience, that is not the norm. That's more of like an outlier where it would be wonderful if there was more of that. And then we have psychologists. Any psychologists who want to add to this dialogue, comment below. My understanding is that generally speaking, yes, psychologists provide therapy and they can diagnose because most of their training is in psychological assessment, which means that a lot of people become psychologists to focus on doing assessments, and they can also provide ongoing therapy. Psychologists cannot prescribe medication. I'm interrupting the flow of this video because literally one of the most important distinctions between psychologists and therapists is what I forgot to mention, which is that psychologists have a doctorate level degree. They have a PhD or a PsyD, and licensed professional counselors, licensed clinical social workers, marriage family therapists, which is another license under the umbrella of therapists that I forgot to mention. We don't have PhDs, doctorate degrees. You can get them. You can get a doctorate degree and still have your license. And then there is the umbrella term of therapist, which can include licensed professional counselor, licensed clinical social worker, and psychologist, because again, psychologists can provide ongoing therapy. The difference between psychologists and like a licensed professional counselor, licensed clinical social worker, is that psychologists often have more extensive training in diagnosing, which is why they can do diagnostic assessments. Therapists, LCSWs, LPCs, can diagnose, but we often do not have the training to do like formal diagnostic assessments. And therapists cannot prescribe medication. So to recap, psychiatrists can diagnose, prescribe medications, and technically do ongoing therapy. Psychologists can diagnose, do formal assessments, and ongoing therapy. And therapists can diagnose and do ongoing therapy, but do not have as intensive of training and education in formal diagnostic assessment as psychologists.